These are the lecture notes from chapter 34 on the respiratory system, and we are starting with slide 25. And we're going to talk about birds a little bit because even though we're focusing more on the human respiratory system, the way that they breathe, their ventilation mechanism is really interesting. So you know how when we breathe, we inhale and exhale, right? So that is a two-way ventilation mechanism. There's air coming in and air going back out the same way it came in. Birds use a one-way ventilation mechanism. So incoming air is carried past the lungs by a trachea, and then that air goes to posterior air sacs, which means they're in the back. Air passes forward through the lungs to anterior air sacs, so it goes posterior air sacs, lungs, and then anterior air sacs. And then it is expelled. So it never goes back the way it came. And the air never, when we breathe air in, we breathe it back out through the same pathway. So we would say the pathway of air leaving our lungs would be opposite of what it is entering our lungs. But it's not that way with birds. In this way, fresh air never mixes with used air in the bird lungs, and that increases their gas exchange efficiency, which they need because they fly and they need to have efficient respiration. So here you can see the bird does have tiny little nostrils up here, and the air enters this way. And then it goes to the posterior air sacs, and then the lungs, and then the anterior air sacs, where it is expelled. So, and you can see this blue diagram. So the air being inhaled enters into the posterior air sacs, then the lung, and then the anterior air sacs. And then the anterior air sacs connect to this opening, and the air exits from the anterior air sacs. So it never passes it never goes back the same way, and when the bird breathes out, I guess you can say, is that the air that leaves, I'm looking at it, and it looks like when it leaves, it does go the same way, but I see what they mean. Okay, anyway, it's still very interesting. So now let's focus more on humans, because I'm a whole lot more likely to ask questions on the test about human respiration. So the average breathing rate for adults, and this is just resting, not exercising or anything like that, just resting breathing rate, is about 12 to 20 breaths per minute or ventilations per minute. And I hear people who are in the healthcare field, they'll either call them ventilations, or that's normally, or respirations. Ventilations or respirations. I'm sorry, I had someone come in my office. Okay, so here we go. Respirations or ventilations is 12 to 20 breaths per minute, BPMs, and the rhythm of ventilation, in other words, how fast you're breathing, is controlled by the respiratory center in the medulla oblongata. The respiratory center is sensitive to hydrogen ion levels, so that means it is sensitive to pH. When the pH is low or high, usually it's around 7.4, but when it falls too low or rises too high, the respiratory center will kick in. So what happens in the way that breathing affects pH is that carbon dioxide reacts with water and releases hydrogen ions. So basically, carbon dioxide and water together make your body fluids or your blood more acidic. They raise the hydrogen ion levels, which lowers the pH, and it makes your blood more acidic. Well, the respiratory center will be sensitive to that change in hydrogen ion levels or pH. And if your hydrogen ion levels are high, then your respiratory center is going to kick in and cause you to breathe a lot faster and deeper to get rid of all that excess carbon dioxide, which is the real reason that you're building up hydrogen ions. because when carbon dioxide reacts with the water in your body fluids, it causes the release of hydrogen ions, and it causes your pH to lower. So you're going to breathe faster and deeper to get rid of that CO2. But then if the opposite happens, if your pH rises too high, then you're going to breathe slower so you actually can take in more CO2 slower. So not that, but you're breathing slower so you don't get rid of as much CO2. And it just shows you the location of the respiratory system in the respiratory center in the medulla oblongata in your brainstem. And then internal and external respiration. These are illustrations that show those processes. If you look at external respiration, what's happening with oxygen is oxygen from the alveoli is entering the red blood cell and attaching to hemoglobin on the red blood cell. So oxygen from the alveoli is entering into the blood, the pulmonary capillary. So, and you can see where the lining of the capillary and the lining of the air sac is so thin. That respiratory membrane has to be very thin, it has to be moist, and then there has to be a lot of it. And that's why we have all these small alveoli, all these millions of them. Now for carbon dioxide is building up in the blood because it built up in the tissues. Because the tissue cells are going through cellular respiration and they're building up CO2 as a byproduct. And that CO2 has to get out. So it travels through our blood to our air sacs, and it leaves the blood and enters the air sacs, and we breathe it out. Now, that is external respiration. Internal respiration is between our blood and our tissue cells. So all of our tissue cells have to get oxygen. The oxygen leaves the blood and enters the cell. And then our tissue cells are building up CO2, so the CO2 leaves the cell and enters the blood, and that is internal respiration. As far as how oxygen and carbon dioxide are transported, it's a little bit different. There's some overlap, but basically most oxygen entering the pulmonary capillaries or the blood from the lungs combines with hemoglobin. And so hemoglobin transports most of the oxygen throughout our blood to our tissues. During internal respiration, that hemoglobin, which is called oxyhemoglobin, gives up the oxygen, and that oxygen diffuses into the tissue fluid, into our tissue cells. And for carbon dioxide, the carbon dioxide that builds up in our cells, a small amount combines with hemoglobin. So hemoglobin does transport a very small amount of CO2 through our blood. But most of that carbon dioxide undergoes a chemical reaction. It combines with water, forms carbonic acid, and then the carbonic acid immediately breaks up into bicarbonate ions and hydrogen ions. So in other words, a simple way to say it is carbon dioxide is changed to bicarbonate, and it's transported in the form of bicarbonate ions through the blood. And I'll show you what that looks like. This is CO2 combining with water, forms carbonic acid, and then that carbonic acid immediately breaks up into hydrogen and bicarbonate. And so most CO2 is transported as bicarbonate until it gets to the air sacs. It's converted back to CO2 and we breathe it out. And this is just a picture of the hemoglobin molecule, and it can transport 4 oxygen molecules because there are 4 heme molecules that contain iron. And each iron is what the oxygen actually attaches to. So because there are 4 iron atoms in a hemoglobin, 4 oxygen molecules can be transported. Now, respiratory disorders, of course, there's the common cold that happens in the upper respiratory tract. It's a mild viral infection, which is why we cannot use antibiotics to treat it. It's characterized by sneezing, runny nose, and mild fever. Lasts a few days before the virus is eliminated by our immune system. There are different strains that cause the common cold, for example, coronavirus, which also, of course, causes COVID. And that is why it's hard to make a vaccine. It's impossible to make a vaccine for the common cold because there's so many different strains. And antibiotics are ineffective again because that's what you take if it's a bacterial infection, and this is viral. Common cold is viral. Strep throat is a bacterial infection, and the bacterium is called Streptococcus pyogenes. And strep throat is also known as acute pharyngitis or inflammation of the throat, pharyngitis. But it is caused by a bacterium, so it is treated with antibiotics. It causes a severe sore throat, high fever, and white patches on the tonsils, as you can see. And disorder of the lower respiratory tract includes choking, and we use the Heimlich maneuver to expel the object when someone has choked, expel the object from their windpipe or trachea. And then we have acute bronchitis, which is just an infection of the bronchi. And this can be caused by different things. In bronchitis is inflammation of the bronchi. So if it's acute, then it's I guess not as serious. It doesn't last as long, but when you have chronic bronchitis, it's just something that a person always deals with. Smoking is a big contributor to chronic bronchitis. And then asthma is when the airways are unusually sensitive to specific irritants. And when exposed to these irritants, the smooth muscles in the bronchioles, the branches of the bronchi, will spasm, and it will cause them to have trouble breathing. Then more disorders of the lower respiratory tract include pneumonia, which can be viral, bacterial, or fungal. And it causes the bronchi and alveoli to fill with fluid, pus and fluid. And then there's tuberculosis, which is something that we do get a vaccine for. And even though it's a bacterium that causes tuberculosis, we still have a vaccine for that. There are vaccines for bacterial infections too. So Mycobacterium tuberculosis is the bacterium that causes it. And almost everyone in America gets this vaccine. So we don't have a lot of tuberculosis in America, but it does say the incidence of tuberculosis is rising in areas of the world where HIV is common. So like Africa. There is a TB skin test, which you may have had done before, you probably have, and it can determine if one has been exposed to that bacterium. Emphysema is when the alveoli are distended and the walls of the alveoli are damaged. That reduces the surface area for gas exchange, and it makes it hard to breathe. Contributes to COPD, which is chronic obstructive pulmonary disease, particularly in smokers. I do know that people get COPD that never smoked or aren't smokers because my husband has it. He also has asthma, and he deals with a lot of every year he will have something, pneumonia, asthma, bronchitis. He just is always having trouble with his lungs and having infections and that kind of thing. And he has COPD, and he does not smoke and never smoked a whole lot, And then, so emphysema, I know that it is contributed mostly to smoking, and so is chronic bronchitis, but it's not always, not always the case. And people with COPD are not always, former smokers or smokers. But a lot of times they are. Statistically speaking, they are. Then there's pulmonary fibrosis, which is when fibrous connective tissue builds up in the lungs. Again, it's going to make it harder to breathe. Lung cancer, when it starts in the lungs, it's called lung cancer. And then lung cancer is known for metastasizing or spreading. Cystic fibrosis is a genetic disorder, and this defective gene results in the accumulation of mucus secretions in the lungs, and treatment involves clearing the mucus by administering mucus thinning drugs and also slapping the patient on the back. They have also been trying gene therapy strategies to treat cystic fibrosis. These are pictures of a normal lung versus a lung with emphysema and a lung that has lung cancer. And that is it for chapter 34.